Ticagrelor is an advanced antiplatelet agent. It works by reversibly binding to P2Y12 receptors on platelets, which inhibits platelet aggregation, a key step in clot formation. It's especially used in adult patients with acute coronary syndrome, ACS, for both prevention and treatment of thromboembolic events. Importantly, it belongs to the non-thienopyridine class, which sets it apart from older drugs. Discovery and background. Ticagrelor was developed to overcome the limitations of ATP analogs, which had short half-lives and were only used intravenously. Originally known as AZD6140, it was later renamed Ticagrelor. Chemically, it is part of the cyclopentyl triazolopyrimidine (CPTP) family, and structurally, it is distinct from ATP analogs as it lacks the adenosine group. Properties of Ticagrelor. One of the key advantages of Ticagrelor is that it does not require liver activation like clopidogrel or prasugrel. It works directly and more quickly. Its major active metabolite, RC124910XX, also blocks the P2Y12 receptor, adding to its effect. Brand names. Ticagrelor is marketed globally under various names. Brilinda in the US, Posea or Brilic in the EU, and others like Hitica, Cargrel, and Anplog in different regions. Pharmacodynamics. Ticagrelor works fast, within 30 to 60 minutes, reaching peak effect in 2 to 4 hours, and lasting up to 48 hours. It's reversible, with an offset of 3 to 5 days. Beyond platelets. This causes more adenosine to stay in circulation, leading to vasodilation, reduced inflammation, and myocardial protection. Pharmacokinetics. Because of its rapid onset and dual mechanisms, Ticagrelor is highly effective, but not without caution. It should be avoided in patients with a history of bleeding, especially intracranial hemorrhage or active bleeding disorders. Also, avoid use in patients with hypersensitivity reactions to the drug. Pregnancy and breastfeeding. In pregnancy, Ticagrelor should only be used if the benefits outweigh the risks, since animal studies have shown fetal abnormalities. It's also not recommended during breastfeeding, as it's been found in the milk of rats, though its presence in human milk is still unknown. Dosage and administration. The standard loading dose is 180 mg, followed by 90 mg twice daily, and then 60 mg BID for maintenance. It should be used with low-dose aspirin, typically 75 to 100 mg. Also, it must not be combined with other oral P2Y12 inhibitors. Therapeutic and clinical uses. Ticagrelor is a reversible oral P2Y12 inhibitor ideal for treating ACS. It's fast-acting and effective across all ACS types. After percutaneous coronary intervention, PCI, it's a valuable part of dual antiplatelet therapy, DAPT. It also shows benefit in post-ME patients, especially beyond 1 year, and in peripheral artery disease, PAD. Clinical trials like Plato confirmed that Ticagrelor is more effective than clopidogrel in reducing cardiovascular events, with a comparable bleeding risk. Pharmacological effects and interactions. Besides inhibiting platelets and increasing adenosine, Ticagrelor can interact with drugs that affect CYP3A enzymes, as it is metabolized through this pathway. Caution is advised when taken with strong inhibitors or inducers. Thank you. To conclude, Ticagrelor represents a significant advancement in antiplatelet therapy. Its fast onset, reversibility, and dual mechanism, blocking P2Y12 and enhancing adenosine, make it a preferred choice in many clinical settings. Thank you for your attention.